Ladies and gentlemen, may I have your attention, because we are starting with a very special session. I'd like to introduce my dear colleague, who is also the Vice President of HTAi, Ravia Kaveci, and her colleague, Oresta Pinjago, from Ukraine, and they are going to tell you about the situation in Ukraine and how they move forward with HTA. So the floor is yours, Ravia.
Thank you, Aya. Dear colleagues, ladies and gentlemen, dear friends, we are invited to speak at this special session, and indeed it's special, as we will talk about how the HTA journey in Ukraine has been affected with the ongoing challenge of the war. I will try to speak with my both hats of HTAi and the SafeMed project I'm working in. As our society's president, Vaya Ortwine, emphasized in her opening remarks, HTAi is standing with Ukraine and other settings where the health of the people is under attack. Following the invasion of Ukraine in February, HTAi immediately issued a statement condemning the invasion and underscoring our support for our friends and colleagues. We also suspended the membership of state-funded organizations from Russian Federation, and today we continue to seek opportunities to offer tangible support to Ukraine. SafeMed, the project I'm working in, is a USAID-funded project, and it's led by Management Sciences for Health. And now we are in, I'm sorry, I kind of get emotional when I talk about Ukraine. So now the project is in its 5th year, and it does provide technical support to the Ukrainian Ministry of Health to establish pharmaceutical policies for improving access to effective, safe, and affordable medicines. And one of our support area is HTA institutionalization that I'm leading. Unfortunately, by the 24th February this year, all our lives and the project had to adapt to a new life with the unexpected and uncertain moments. I have lived in Ukraine for almost 4 years. I had to immediately evacuate just before the war to my home country. And many of our staff in the project had to move to other countries or to other places within the country. And some stayed in Kiev, and one of our dear colleagues joined the army. Well, from distance, we continue to support Ministry of Health with many new activities addressing new emerging needs. We also continue to support HTA, essential medicine list, procurement and supply chain processes, so that the patients can still have access to medicines. Just to give you a quick snapshot of the country's situation, there are almost 15 million people displaced, around 5 million became refugees in other countries, some of them came back, many are still in other countries. Men stayed behind to fight, whereas women and children had to secure themselves, leaving many families apart. Almost 5,000 confirmed civilian deaths, including many children, thousands of people injured. Expected military losses could reach up to tens of thousands of people. Almost all cities affected, some completely destroyed, many still under occupation and hot fight. In such a scale of attack, almost 300 attacks were towards health and education institutions. 240 healthcare facilities hugely impacted that prevented their functioning, most of them being hospitals. In the first month of the war, only half of the pharmacies were functioning. Logistics was and still is a big problem, which prevents timely supply of the medicines. Unfortunately, some manufacturing sites, some pharma factories of local manufacturers were destroyed, some warehouses of the medicines were bombed, and which unfortunately risked availability of the medicines in the country. In spite of all this devastating situation, Ministry of Health showed resilience and continued to work night and day to improve health services. The system adapted itself to collecting, communicating, and supplying the needs to the regions and patients, engaging stakeholders at all levels, and receiving humanitarian aid from all over the world. International organizations such as ours increased support so that the system can continue functioning in the best way possible. Recently, a recovery plan is initiated for the Ukrainian healthcare system, as we believe these days will be over and Ukraine will be prepared to recover quickly. When you have challenges, you definitely need to adapt decision-making processes according to the new circumstances. COVID-19 showed us a little bit about this, and the war indeed aggravated the need for decision-making under uncertainties, high risks, and threats. The HTA development in Ukraine, before the war, had already started to be seen as an outstanding example for a lower middle-income country, an evolution from a very fragmented and ad hoc decision-making system to a more structured model based on HTA with broad stakeholder engagement, published methods and guides, strengthened legal framework, capacity improved, and clear roadmap followed. And the impact is already observed. And with the war, I have to tell you that HTA team in Ukraine has shown enormous resilience to stay strong, stay fully functioning, and continue supporting their ministry in their decisions. Oresta will talk about these more, but I just cannot pass this moment without congratulating herself and her beautiful team of colleagues in the department who worked under difficult circumstances. We don't know how HTA will look like in 10 years from now in Ukraine, but we know that they are already part of the history as an outstanding example of implementation of HTA in a low-resource setting and even resilience being tested by a war. So with this, I want to give the floor to my dear colleague, Oresta Piniashko, the director of the HTA department in Ukraine.
Thank you very much. Good morning, dear colleagues. Thank you for introduction, and thank you very much for opportunity from organizers to have a speech and reflection from the Ukrainian perspective. So how do we train resilience, and what help us to continue our everyday work during the time in war in Ukraine? I would ask changing the slides. I'm very sorry. Health technology assessment in Ukraine was established by the new process in 2019 when the HTA department was established as State Expert Center of the Ministry of Health. And the results of the introduction of health technology assessment was presented by the expert interview and analysis, which was performed by the SafeMed project international support in Ukraine for implementation of HTA. And in 2021, in December, the results were presented in the stakeholders roundtable with the main outcomes and 100% satisfaction from all the stakeholders, which we work together. And it's a very good follow-up for the plenary session in the morning regarding the results of the stakeholders' involvement, and for sure we make a good platform for interaction and received future suggestions for the management of HTA process of State Expert Center and HTA department from stakeholders. But on the 24th of February, the life changed dramatically for all Ukrainian citizens and for the whole world. So, next slide, please. And Ukraine is a country in the Central Europe with inhabitants of over 44 million, and the percentages of healthcare expenditures are 7% of GDP, and GDP per capita is over $3,700. So the main healthcare expenditures are out of pocket, and they are evaluated of over 50%. So the new tools and new instruments for the decision-making processes as health technology assessment were important introduction in the healthcare reforms in Ukraine to improve patient access to medicines and improve quality of care as we worked with our team. Next slide, please. So overall, the results of HTA implementation in Ukraine for the last 2 years, we developed over 34 HTA recommendations and conclusions for the Ministry of Health, and it had impact in the decision-making process on the inclusion of new medicines to the regulatory lists, national list of essential medicines to central nomenclature programs, and introduction of managed entry agreements. Next slide. And with what helped us to continue to be resilient to this war and the aggression to Ukraine and military invasion. So the well-established process framework and a legislative framework, including the main Cabinet of Ministers decree, the health technology assessment guidelines, which were developed by our team of HTA department and main stakeholders in Ukraine, and which are based on the main international best practices in Ukraine. Next slide. And over the last months, yes, it's almost over 5 months of war in Ukraine, we provided over 10 recommendations to the Ministry of Health for the main important areas of work for access to medicines in Ukraine, for emergency care, for high burden diseases, for cardiovascular diseases, diabetes, for oncology, including also access to innovative medicines and with recommendations to implement managed entry agreements, to hepatitis and to orphan diseases. Next slide. And what the core, from my perspective, the core help which keeps us together and continue our everyday work, we, with main part of our team of HTA department, we work continue in Ukraine, and we developed together. We have common values in the improvement of the healthcare system in Ukraine and assessing medicines to improve the access to them for patients in Ukraine. So we grew together and continue our work with the main values. Next slides. And also, one of the main factors that helped us to keep and continue our work is our international cooperation. And, for example, as we had yesterday a lot of discussion about future of joint HTA assessments, so our team of HTA department was participants of 5 joint projects with EUNETA, which developed trust, as we mentioned in the plenary today in the morning, for the process, yes, and cooperation with the national and international stakeholders, which provided well-established platform for HTA implementation in Ukraine. So thank you very much for standing with us, and we are happy and ready to cooperate in our future projects and to continue our research together. Thank you for standing with Ukraine.
Thank you. Thank you so much. Thank you so much for your support for Ukraine. I also encourage all our HTAi colleagues to continue supporting any HTA advocate around the world who are working in difficult circumstances. So thank you. Please enjoy the rest of the meeting.